So the third file we wanted to look at is one that was referred to as the Health Sector Payment Transparency Act. And I know that this was a big concern on the healthcare front, Abid. So what exactly was it?
Well, this was a part of a larger bill, an omnibus bill that the government passed in December of last year, called the Strengthening Quality and Accountability for Patients Act. Amongst the various pieces was a comprehensive piece of legislation that would mandate those certain payers, certain companies within the healthcare sector who are involved in the healthcare sector, to disclose any payments that they make to certain recipients. So, for example, a drug company, if they sell pharmaceutical products into the healthcare sector and they make a payment, for example, to a physician, or even to serve as a consultant, or fund some of their research, or even sponsor an event for an association, all of those various payments would have to be disclosed. And literally, the per payment on a line-by-line basis with a description, and then rolled up and sent over to the government on a yearly basis. This includes, for example, taking a physician out, or any healthcare professional out to lunch. And if the lunch is over $10, that would have to be disclosed. Of course, the rationale behind it was to determine whether or not there was any influence, or what kind of payments were being made, to determine whether or not potentially there was some influence. It wasn't necessarily there to pass judgment on those patients, on those payments, but to at least put that out in the open so that people can decide for themselves. There are certain pharmaceutical companies who are actually very much in favor of this, of the transparency. They want to create a level playing field, and I think some of them have voluntarily disclosed on an aggregate basis, although not on a line-by-line basis. But there are others, and a whole host of others, who might feel that this is a bit onerous. Because it's not just pharmaceutical companies, it's medical devices, and it's those, generally speaking, who sell into the healthcare market. So I think that the government is going to have to make a decision about whether or not it intends to move forward with the regulations that were posted by the Wynne government back where comments were due by April 6th. But have still not been proclaimed. So this is a piece of legislation that has not been proclaimed. One might think that the Ford government might view this as additional regulatory burden on businesses, even though it does involve public dollars in many cases. Although the legislation doesn't necessarily deal only with public dollars, it also deals with those on the private side as well. It's unclear how they're going to react. But the original timeline was for this legislation to be in effect, so that for the 2019 calendar year, all payments would be kind of recorded and had to be sent to the ministry in 2020. We'll have to see how that works.
Absolutely.
I think that the interesting thing about this is that just the regulatory burden on businesses, the offenses in there. One of the things that I read that stood out at me when I looked at it was that the fines were $50,000 per day, very hefty fines, no imprisonment, but it just goes to show you how important a piece of legislation this is that has not yet been proclaimed.